Knowing what I know now as a PA and a mom of 4, if I were pregnant right now, there are a few things that I would start doing right away. And honestly, they're probably not the things that many people spend their time worrying about. So today, I'm sharing 10 things that I would focus to give my baby the best, healthiest start possible and help me keep my sanity in the meantime. By the way, I'm Diana, a physician assistant specialized in women's health and gynecology. I'm also a mom of 4, and if you are new here, this just might be your new favorite pregnancy and women's health mama channel. I don't know. You tell me after you watch this video. But subscribe if you want to, and then let me know in the comment section how far you are. Now, some of these things are going to sound simple, but I promise the reason behind each one is going to change how seriously you take it. But number 1, move your body, even when you absolutely do not feel like it. And I'm not saying this as a weight management tip. I've already done videos about exercise in pregnancy. I am saying this because of what the evidence shows about movement and labor. So women who stay consistently active during pregnancy often have better endurance, fewer pregnancy-related aches, and may even have a smoother labor and recovery. Now, it's not a guarantee, but movement is one of the best supported habits in an uncomplicated pregnancy. Now, think about it this way. Labor is going to be one of the most physically demanding event of your entire life. So you want to be as physically prepared as you possibly can be. So for somebody in the first trimester, take a walk, even a 10-minute walk, even if you feel awful, which incidentally, most of us do in the first trimester thanks to morning sickness. But movement actually helps with nausea because it improves circulation and it also helps regulate blood sugar. Now, for somebody in the second trimester, this is usually when your energy comes back. So use it if you're feeling it. You can up the intensity or the time of your walks, but just remember, when you are exercising, make sure that you don't get so out of breath that you cannot carry on a normal conversation with somebody. If you are too winded to speak a full sentence, you might be overdoing it. But you could do things like prenatal yoga or swimming or light resistance training. But do it now when it feels good and when you actually have the energy. Now, in the third trimester, the energy level drops again, but keep going. Just go shorter and be more gentle on your body. Now, remember, your body is preparing for labor whether you help it or not. So you may as well help it. Now, as always, make sure to ask your medical provider before starting any exercise programs. But for most uncomplicated pregnancies, exercise is generally considered safe. Number 2, try to eat protein at every meal. Now, this is really important. Here's why. Pregnancy hormones, specifically progesterone, slow down your digestion. So food moves through your stomach more slowly than it normally would, which means your blood sugar swings are more dramatic, which means the crash when you haven't eaten feels worse, which means nausea and fatigue and headache and mood dips are more intense than what they need to be. But here's where protein makes the real difference. Protein stabilizes all that. So it slows the absorption of glucose and it keeps your blood sugar steadier for longer, which will give you more consistent energy. It can also help with nausea, and it may even help with that mid-afternoon crash that we sometimes feel. Now, so what does this actually look like? You could do eggs at breakfast. You could do Greek yogurt or cottage cheese as a snack. You could do beans. Now, a couple of years back, I pointed out that lentils are a great source of protein, but I never ate it myself and I don't really know how to cook it. And I was surprised at how many of you commented about your favorite lentil recipes and how to cook it. It was really informative. So what do you guys do? Do you eat lentils? And if so, what are your favorite recipes? I'm really curious. Anyways, just a few side notes. Fish is a great source of protein, but make sure to avoid high mercury fish like swordfish or mackerel. And then also make sure it's cooked. Now, I know personally, I died inside a little each pregnancy when I couldn't eat sushi for 9 months. I know there's some debate on the safety of that right now, but the current recommendations are no raw fish. And then if you do like deli meat, make sure to cook it. Now, a pro tip: keep something protein based on your nightstand. So this is genuinely one of the highest impact yet lowest effort changes that you can make. So maybe some almonds or a protein bar, beef jerky. These are really easy to store by your nightstand and really quick and easy to grab when you need it. Now, another reason that protein matters, your baby's brain development depends heavily on amino acids, which come from protein. So this really isn't about eating perfectly, but I do think that it's important to have protein in each meal automatically rather than just trying to add it as an afterthought. Number 3, take your prenatals at night with food, not in the morning. This took some trial and error for me to figure out my first pregnancy, but here's why this matters. Most prenatal vitamins contain iron. Iron, super important for your pregnancy, but iron on an empty stomach or first thing in the morning when you're already nauseous is genuinely rough on your stomach. It makes your nausea worse, and it can also cause stomach cramping. And a lot of women end up stopping their prenatals consistently because of that, which is not a good idea. So taking it at night does 2 things. Number 1, you're less likely to feel the side effects of prenatal vitamins because you can just sleep right through it. And then number 2, iron absorbs better when you take it with vitamin C, which you're more likely to have with dinner than taking it first thing in the morning on an empty stomach. So a good habit would be to put your prenatals next to something that you do routinely every single night, like putting it next to your toothbrush. So you make it a part of brushing your teeth at night or anything else that you do every single night so that you will always remember to take it. That's it. That one change really can make a big difference in how consistently women actually take their prenatals. Okay, now those first 3 things were all physical things, but the next 2 are more about information. And I think these things might be the most underrated habits on the list because nobody talks about the mental load of pregnancy and how much the wrong information actually costs you. You know, a while back ago, I had a YouTube comment that said, "I wish you were my doctor." And I responded, "I'm sorry, I can't be your medical provider over the internet, but I can do something even better. I can be your educator and your guide. The person in your corner who has spent over a decade in that delivery room, and I've also been the patient in the bed and on the C-section table 4 times actually. And I can prepare you for what's actually coming. I can be your educator and supporter to guide you through literally one of the most life-changing experiences of your entire life, both physically and emotionally. Everything changes the day you go into labor. So you don't want that day to happen without being as prepared as you possibly can. I'm not going to promise you a perfect birth. That's not how labor works. And we all know that. But what I will promise you is this. You can walk into that room prepared. Not prepared to control every outcome, but prepared to understand what's actually happening, to ask the right questions, to know how to navigate the twists and turns of labor without feeling like it's all just happening to you. That's what makes you an informed patient. And an informed patient is not the same thing as a passive patient. Now, Own My Birth is a course that I built exactly for that. It's everything you need to know. The nutrition, the pain relief, the breathing, the birth preferences, all of that. But more than that, it gives you a framework for making decisions in real time, in the room when it matters the most, because you deserve to be part of what happens in one of the most significant days of your life. Every pregnant woman knows that they need to take a prenatal and labor prep course, but this is the one that you need to take. The link is in the video description. Now on to number 4, which is keeping a journal. Now, I know, to some people that's gonna seem really, old-fashioned, because we document everything on our phones and on social media. But look, pictures and videos are what you see, or what others see. But keeping a journal records what and how you feel, your excitements, your fears, your goals, and all of that. And I know when you are experiencing something amazing, like feeling the baby move for the first time, you think that's a moment that you would never forget. And maybe you won't, but I'm here to tell you, there will be moments and experiences that you absolutely are going to forget. Trust me on that. And you won't even know that you forgot them. They will be experiences lost forever simply because you didn't record them. So keep a journal. Number 5, stop Googling your symptoms at 2 a.m. I know you're gonna do it anyway, but let me clarify. I'm not saying don't look up your symptoms online, but let me tell you what's actually happening when you do it in the middle of the night. Now keep in mind this is a generalization. At 2 a.m., your cortisol is naturally lower. Your ability to contextualize information is also lower, plus your anxiety response is more sensitive, which means that whatever you read at 2 a.m., even something that would normally be reassuring, just gonna land differently than it would, say, at 10 in the morning. And the thing to remember is that pregnancy symptom searches almost never lead to reassuring results because the internet is built to show you the most alarming possibilities first. So if you Google headache, you're going to be reading about brain tumors, or in the case of pregnancy, maybe preeclampsia. If you Googled stomach ache, you're going to be reading about miscarriages or ectopic pregnancy. If you Google about leg swelling, you're going to be reading about blood clots. And yes, those serious conditions are real, and I don't want you to ignore symptoms that need medical attention, but reading worst case scenarios at 3 a.m. when you're tired and you're anxious and you're not sure what applies to you usually does not help you think more clearly. So set a rule for yourself. No open internet symptom searches after 9 p.m. or 10 p.m. Instead, bookmark one or two trusted resources like your provider's patient portal or your after-hours nurse line or even a reputable medical site, and use those instead of scrolling through random searches and results. And if something genuinely concerns you, write it down and then call your medical provider. That's what the phone is for. Not for Googling, is morning sickness okay in the middle of the night? This is sort of a follow-up to number 5 and also somewhat of a disclaimer. So number 6 is learn the red flags. Number 5 was about not overreacting to normal pregnancy symptoms. Number 6 is recognizing not when to panic, but when you do need to act fast. So before you are in the moment, learn what your provider wants you to call for. So at your next OB appointment, ask, what symptoms should I call about right away? Because your provider can answer that based on your pregnancy, your history, and what's going on with you specifically. But in general, you want to pay attention to things like heavy bleeding, severe belly pain, a headache that won't go away right away, vision changes, chest pain, trouble breathing, severe sudden swelling of your face or your hands, leaking fluid, decreased fetal movements, or thoughts of hurting yourself or somebody else. Those are not wait and see for a couple of days symptoms. And I don't say that to scare you. I say that because when you already know what matters, then you don't have to sit there wondering, am I overreacting? Should I call? Should I go in? If you are having one of those symptoms, call your medical provider right away. And if you can't reach them or something feels severe, urgent, just go in. Number 7, build one trusted source and then stop crowdsourcing your anxiety. And here's what I mean. This is different from the Googling habit that I mentioned earlier. This is about the Facebook groups and the Reddit threads and also the well-meaning family members who had babies 30 years ago and have really strong opinions about things. So here's the problem with crowdsourcing your pregnancy decisions. You're getting information filtered through other people's fears, other people's experiences, and other people's medical histories, none of which are yours. And when you get 47 different answers to a question, you don't end up more informed, you really end up more confused and more anxious. So choose one clinician you trust, one evidence-based resource for your information, and if you want, choose one community for your emotional support, not diagnosis. Use each one for its actual purposes. Social groups are genuinely valuable for feeling less alone, but they're not valuable for determining whether your symptoms are normal. So know the difference so that you can protect your mental health accordingly. Now, on a side note, I do have a pregnancy and new mom community. It's free to join, and it's filled with an amazing group of women who are supporting each other, cheering each other on, and it's a really great place to be through your pregnancy and through your new mom journey. Now, in that community, you can also find my Own My Birth Prep course. I will link to that in the video description, so check it out. At least join the free community. It's an amazing place to be. Number 8, learn what your body will actually do in labor before you're in it. Now, I want to tell you something about fear in labor. Research consistently shows that women who go into labor with a working understanding of what's happening, so what the stages are, what contractions feel like, and why, and what normal progress looks like, these women have a measurably different experience than women who don't. Not because knowledge eliminates pain, it doesn't, but because fear amplifies pain. And the antidote to fear is almost always information. It's knowledge. And when you don't know what's happening in your body, your brain can interpret that as danger. But when you do know, and then you recognize, for example, this is the transition phase, this is the hardest part, this means I'm close to the baby coming out, then you can work with it instead of against it. You don't really need an elaborate birth plan. You need a working mental model of what labor actually is. So read a good pregnancy book, take one focused prenatal and labor course. That's not a perfect birth plan, but it's knowledge that when you are in labor, you recognize what is happening. It makes an amazingly huge difference. All right, 2 more. And if you were thinking about clicking off at this point, don't, because I think that these get the least airtime in pregnancy conversations, but they both have an enormous impact on how you feel after birth. So number 9, move your pelvic floor from passenger to participant. Here's what I mean. Most women, when they hear pelvic floor support, and then they do a few half-hearted Kegels a couple of times before labor. That's not really that effective. But here's what your pelvic floor is actually doing during pregnancy and birth. Your pelvic floor is kind of like a hammock, and it's supporting your uterus, your bladder, and your bowels. And it's carrying significantly more weight than it normally does for 9 months. During labor, it needs to be able to both contract and then fully relax to allow the baby to descend. And then after birth, how well you recover, so leaking, prolapse risk, core function, that's directly related on how well that system was prepared. Kegels alone are not going to cut it. In fact, some women have pelvic floors that are too tight, and doing more Kegels can make things worse, not better. So what matters the most here is function, the ability to both engage and fully release those muscles. So what you can do is find a pelvic floor physical therapist and go at least once during your pregnancy. Even one session can give you a baseline assessment and then also exercises that are actually appropriate for your body. Now, if that is not accessible, you can also look for evidence-based guided pelvic floor programs online, not just Kegel counters, okay? Your pelvic floor is going to do something remarkable, so make sure to help prepare it. Finally, number 10, start thinking about postpartum right now. Not at 39 weeks, right now, wherever you are in your pregnancy. So first off, we're not talking about baby items. So this is not nursery stuff, crib, diapers, cute outfits. I know that you're already doing that. I'm talking about you and what you personally need during the postpartum period. Because I've watched enough women move through pregnancy and into the postpartum phase to know that the ones who thought about it early, even a little bit, had a fundamentally different experience than the ones who didn't think about it or plan for it at all. So here's the reality of postpartum that doesn't get talked about enough. You will be physically recovering from one of the most significant events your body has ever been through. You're going to be running on fragmented sleep. Your hormones are going to drop dramatically after birth. And all the while, you are responsible for keeping a brand new human being alive. And many of you are doing that with little or no support and conflicting advice. So I want to offer you a simple challenge that you can do. Pick one thing this week, just one, and then do it. So a couple of examples might be create a meal plan, have a conversation with your partner about what support looks like to you, order postpartum underwear or a nursing bra. Even just come up with a name and write it down of somebody that you can call when you are having a hard day. Just one thing. And then next week, pick another thing that you can do to prepare and then do that. Now look, you don't have to have it all figured out, but it's way better to have at least some preparation than none at all. All right, so that was 10 things. Let me run through them quickly with you. Move daily. Protein every meal. Prenatals at night with food. Keep a journal. No 2 a.m. Googling. Know the red flags. Pick one trusted source, not the comment section. Learn how labor works. Train your pelvic floor, and then plan postpartum now. Now there's a lot of unpredictability about pregnancy, and a lot of things can happen that you weren't expecting, but these things can definitely make it all a little bit easier. But hey, if you liked this video, save it. Seriously, save it, and then come back to it at different points in your pregnancy, because different items are really gonna hit differently at, say, 8 weeks than they would maybe at 32 weeks. And if you are new to my channel, make sure to check out my pregnancy playlist. I have made a video about every single week of pregnancy, and in each video, I talk about baby development, pregnancy symptoms and how to help with them, must-haves during your pregnancy, what to expect at your OB appointment, and so much more. So I am going to link to that playlist right here. Click on it, go find the week that you're at, maybe check out a few of the earlier videos just to get caught up, but click right there and I will see you over there.